Greetings of the day. I am Dr. Vijay Kumar Loya, orthopedic spine surgeon from Hyderabad. So as you know, today is 5th September, Spinal Cord Injury Day. And theme for this year is access to spinal cord injury services and life less complicated. So what is spinal cord injury? Any injury to spinal cord due to road traffic accident or a fall from height or diving into a shallow pool or a sports related injury can all lead to spinal cord injuries. In the West, even a gunshot injuries can also lead to spinal cord injury. So what are the symptoms of spinal cord injury? Spinal cord injury can lead to some devastating consequences like weakness in your upper or lower limbs, difficulty to control your urine motion. Sometimes it can lead to difficulty in breathing, leading to ventilatory support, and it can also lead to rarely to death. So what are simple tips to prevent spinal cord injury? One of the most important tip is you should make sure that you wear a seat belt while driving. You should also make sure your car has airbags in it. Do not drink and drive. Make sure wherever you're diving, the minimum depth is up to 10 to 12 feet before driving, and wear protective equipment while playing sports. Even a trivial fall for elderly individuals can also lead to spinal cord injury. So you have to make sure your home is fall proof. So as I said before, spinal cord injury can lead to devastating consequences, not just physically or emotionally and psychologically, but also it may lead to change in your vocation. So maximum recovery which can happen after spinal cord injury is in the first 18 months. So you have to make sure that you do active physiotherapy in that phase. You can do high intensity exercises, chest physiotherapy. You have to make sure you move regularly to avoid bed sores, to avoid blood clots, to avoid getting water in your lungs. First thing you need to do is to make your home wheelchair accessible. Another thing which you can do to stay active is swimming. Swimming can help even in quadriplegics. One of the common things after spinal cord injury is loss in bowel and bladder control. So you have to make sure that you know how to put a clean urine tube for emptying your bladder, and you also have to learn pelvic floor exercises to control incontinence. You should take a fiber-rich diet to prevent constipation. Since you may become immunocompromised, you should think about taking vaccines against influenza and pneumococcus. And remember that you can have an active sexual life even after a spinal cord injury, and there are good chances that you may also become pregnant. So remember that spinal cord injury is not totally devastating. You should learn to stay active and remain hopeful. With the support of your near and dear ones, you can get back to near normal life. For any further doubts or queries, you can contact me. Thank you.